everyone, this is your interview with Farah, and I'm here at the Health 2.0 Conference Dubai, and I have with me right now Dr. Fahad. Welcome.
Thank you very much. Thank you for having me.
Of course, it's a pleasure. Could you please introduce yourself and your organization?
Sure. I'm Dr. Fahad Attar. I'm a consultant orthopedic surgeon and the CEO and founder of Regenesis Orthobiologics. So we're a regenerative orthopedics and precision health clinic center based in the UK, looking to expand in the GCC.
Now, I'd like to congratulate you for receiving the Excellence in Healthcare Award.
Thank you very much.
Can you share with us how it felt?
Sure, it's been a great honor and a humbling experience, really, especially in the middle of all of the acclaimed clinicians we're under. So I'd like to thank Conference for giving me the honor and the award. I'd also like to thank, you see, with these clinical excellence awards, it's not just one person who's normally the awardee. So I'd like to thank my team, my colleagues, everyone who's involved in the patient space for improving healthcare and technology. And also I'd like to thank my family, my parents, my children and my wife, because they've been a rock for me with regards to getting through this journey and accomplishing what we have.
Congratulations to everyone behind this success.
Thank you.
Now, can you share with us a little bit about the kind of services that you offer?
Sure. So we're really aimed at trying to offer minimally invasive surgical services for patients suffering with osteoarthritis and sports injuries. So we try and get them back to recovery a lot quicker, trying to avoid surgery. So that's our main ethos. So we use a lot of body's own natural healing potential, such as bone marrow, stem cells, PRP injections. And we also have a lot of support services, such as laser therapy, shockwave therapy. And we sort of use these in combination in a holistic way to try and get the patient back to recovery a lot quicker. And most of these services that we sort of offer patients improve their lifestyle, reduce pain, improve activity levels. And obviously most of this is done without the need for any major surgical procedures.
And based on your experience, how would you say is the regenerative landscape changing right now?
So at the moment, a lot of people are trying to avoid surgery, major surgery. And as we're seeing a lot more younger people getting injuries, a lot more younger people starting to get joint pain, osteoarthritis, we're starting to see a huge number of people coming through the doors for treatment.
Yeah.
So we need to have some management therapies available for them that not necessarily are invasive and not necessarily are surgical. So that's where we found our regenerative therapy services are actually on the increase. The demand is a lot more. People are more inclined to using the body's own natural healing processes, which we offer as well. And also trying to see the people not just from that specific injury and pathology perspective, but also from a background and holistic perspective to try and optimize their lifestyle, their diet. So we've got some nutritionists in our practice that help us do that alongside the therapies we offer. We also have physiotherapists that help with the exercise programs. So we see patients almost from a personalized perspective. So we try and tailor each treatment and each management plan to that specific patient we see. We also do a lot of biological testing and genetic testing as well to try and do some screening for some of these people to see if they're at high risk of developing osteoarthritis. And again, we can manage them early and try and solve their problems and issues earlier so they don't reach the stage where they start having problems in developing osteoarthritis, having joint pains, having problems that need surgical procedures. And what we're seeing is a lot more people now are starting to become a little bit more health conscious as well.
Definitely.
And if they start having any problems sooner rather than later, we always encourage them to start coming in, because if we catch these conditions early, we have good sort of procedures and plans in place that we can address them before they start progressing and getting worse. Because we know with osteoarthritis, once it gets worse and reaches a stage where you've got pretty severe osteoarthritis, the surgery is the only option.
Yeah.
So we try and avoid that. So we try and get people a lot earlier, instate a lot of holistic treatment options that we have to try and delay the progression of the osteoarthritis.
And can you share with us some of the plans that you have set for the future?
Sure. So at the moment, we're just launching our flagship clinic in Manchester. And our immediate UK plans are to open a second clinic within the next 4 to 6 months in London. And we hope that both those clinics will capture most of the UK market. And our 3 to 5 year plan is to open a similar regenerative therapy and precision health clinic in Dubai, in Saudi Arabia. And we're also in talks currently with places around the sort of GCC and also slightly out as well. So we've got talks at the moment going on with Nigeria, with Egypt, with Turkey. So we're looking to slowly expand and get these services set up there as well.
And any advice that you would like to share with those who are in the healthcare sector?
Yes, I think the most important thing, especially for new upcoming people who are involved in the healthcare and trying to sort of become entrepreneurs in this area, it is difficult because normally as we train as physicians and surgeons, we don't really get taught the business side of things. So you've got to really learn a lot more on your own to try and build this up. But the main thing is, because a lot of people have good ideas, a lot of people have innovative ideas, and you just need to get a team together that can help and support you to sort of progress you slowly through the whole progression of getting an idea conceptualized and getting the service or product built, then going to market and then building and scaling and getting the growth on it. So all of those facets have got different skill sets that sometimes a physician might not have by themselves. So it's always good to have a good core team with you, have the people who can complement you as you go along. And I think you need to work and put the hard work in because there's no secondary to that. Once you put your hard work and your time in and you develop and progress your ideas, there's no reason why you cannot be successful.
Now, I'd like to know a little bit more about your experience at the conference. How has it been? How has the networking been going for you?
So the conference has been great. The overall sort of content with regards to the talks itself have been very good. The fireside chats and the panel discussions have been very engaging. And I think, like I said, the quality of the clinicians here is very high and it's very global, which is very good because you get a whole global perspective of what's going on. And I think health and wellness sphere is increasing and it's in big demand, and you can see that with most people you talk to and speak to as well. And already in the small period of time that I've been here, we've already made some good contacts, some good friends, and some good collaborations. And I think that's what these conferences are about, to try and use that for collaborating with like-minded people, like-minded services.
Exactly.
Because at the end of the day, we're all here to improve patient outcome, enhance their journeys, and make that the sort of best central focus.
For sure. Now, if people would like to get in touch with you, where can they find you?
Sure. So obviously you can find me on LinkedIn. LinkedIn I'm quite active on. And we've also got a website, which is regenesis.co.uk, which has got most of our details of contact from us and also my team. So if they can just drop us a line there, we'll be happy. And we're always looking to sort of collaborate and engage with like-minded people with complementary services, especially not just in the UK, but also in the sort of wider area of the GCC and North Africa as well.
Fantastic. Thank you so much, Dr. Fahad. It's been a pleasure, and congratulations again.
Thank you very much. Thanks for having me. Thank you.